Hi, Dr. Garza here, board certified plastic surgeon. Today I'm answering your questions about the mommy makeover. What is a mommy makeover and who is it really for? A mommy makeover is a combination of procedures. It's not just one thing. So it can address areas like the breast, the abdomen, the flanks, etc. If your body has changed after pregnancy or weight loss, a mommy makeover procedure might be right for you. Also, a mommy makeover procedure isn't just for moms. Anyone who wants to address the areas of the breast and abdomen can have a mommy makeover procedure. The mommy makeover name was a clever marketing design. Isn't alliteration fun? Will it look obvious that I've had work done? Not if it's done well. So some of the telltale signs of a mommy makeover are seen in a bathing suit or when you are exposing your tummy area. The classic sign is a visible scar around the belly button. Now there are certain techniques that we use to minimize the scarring in this area and recreate a more natural appearing belly button. The other telltale sign is an abdominal scar. Now we specifically design our scars so that they're low, below the underwear or bikini area. The number one telltale sign of a mommy makeover procedure is someone who has had procedures that create a disproportionate appearance to their physique. Our philosophy is to give elegant, natural results. That means liposuction in tasteful ways, creating contours to the waistline that accentuate your natural physique. And if breast surgery is done specifically with implants, choosing an implant size that is right for you. The goal is always balance, proportion, and natural looking results. Is a mommy makeover painful? Yes. Next question. In all seriousness, mommy makeover procedures can have some discomfort, but we use long-lasting numbing medication that helps blunt some of the pain, especially for the first week, and we have a pain management protocol that we use, and most of our patients feel the pain is very manageable. Do you recommend procedures be done all at one time? That's a tough question. In general, I would say combine the procedures if possible. Procedures that pair well together are a tummy tuck and a breast surgery, such as a breast lift, a breast augmentation. Those are great to combine. The other procedure that can be combined is liposuction 360. This just accentuates the results you're gonna get with the tummy tuck. So liposuction 360, tummy tuck, and a breast surgery, those are great to pair with. Once you start adding other procedures such as a brachioplasty or a thigh lift surgery, I would recommend waiting to have those procedures at a separate time frame. Yes, it causes a second surgery, but the complication risk goes way down by separating out those two procedures. How long is recovery really? Well, that depends on the person. For most patients, the recovery time period is between 2 and 3 weeks. But if I have a patient who has to be quite physical in their job, I may recommend they take more time off, like 4 to 6 weeks. That 6-week time period is the time period where your scars and healing have really come to their endpoint, where they get most of their strength back. So if you're gonna be testing the results and strength of the suturing, etc., you really wanna give it that 6 weeks. But if your job is mostly a desk type job where you have the ability to work from home, 2 to 3 weeks downtime from work is usual. And as far as overall recovery, that 1 to 2 week time period is generally pretty sufficient for people to kind of feel most like themselves. What happens to my belly button? Why do some look fake or odd? Well, when we do a tummy tuck, we still keep your natural belly button. We just reposition it in a new location. Now, why does it look fake? Tummy tucks with a belly button repositioning or a full tummy tuck, you really have to be thoughtful in your planning with this surgery. I pride myself in creating a natural appearing belly button result, and that comes from years of experience doing these procedures, seeing patients long-term and how things ultimately heal, and having conversations with patients. If I have a patient who has an umbilical hernia and they say that having a natural appearing belly button result is very important to them, they may benefit from having an umbilical hernia repair prior to having their tummy tuck procedure. Or I have a patient coming up very soon where she has a very significant umbilical hernia, and what we're gonna do is I'm gonna repair her umbilical hernia and we're gonna do a staged umbilicoplasty, meaning I'm gonna create a new belly button for her at a separate procedure to give her a better result. So belly buttons, if they're not done well, yes, they can look odd and they can look fake and done. And again, that can be one of those indicators that, hey, somebody's had a tummy tuck. But when you go to someone who has lots of experience and does them well, look at their photos on their website and on their Instagram or what have you, and you'll see how their belly buttons look. And if that's something that aligns with your goals, go to that plastic surgeon. Will the skin in my tummy area feel tight after surgery? The answer is yes. You will have some tightness in the area, and that's because we have stretched the skin to some degree to create a flat contour to the abdomen. but it does stretch over time and you will lose some of that tightness feeling, usually within that 3 to 4 week time period, especially after the swelling goes down. How long do results last? This is a good question. Some of this depends on you. So if you maintain a healthy lifestyle and you don't have significant weight changes, the results should last a very long time, especially when it's done well. If, however, you change weight, lose more weight, or gain weight significantly, that can definitely affect the results, which is why we recommend that you're at a stable weight before having surgery. What makes someone a good candidate, and when should you wait instead? A good candidate is someone who's already at their goal weight. Our approach and philosophy is to give you natural, elegant, and long-lasting results. And by waiting till you reach your goal weight, we're able to reveal the hard work that you've done. How long until I see the final results? This is a great question. When somebody comes in to see me and they are talking about having surgery, the downtime, etc., the downtime for recovery includes that final result time period. So people generally feel like themselves and are able to do most things around that 6-week time period, but to see the final results, especially if liposuction 360 is performed, it can take up to 3 to 4 months. You're gonna have swelling in the area, you're gonna have bruising in the area, and those things take time to recover. So when you're in that time period of recovery, give yourself the space and time to heal, and don't try to rush the results. They will come. Do you, Dr. Garza, have any interesting observations about patients and their aftercare? This is an interesting question. So one of the things that I've kind of noticed is I'll have patients come in and they're well into the recovery. You know, we're going over almost their final results and we're kind of reviewing things. And oftentimes I'll show them the before pictures. And it's always one of my most cherished and rewarding things that I go through as a plastic surgeon is seeing the before and afters. And when I show them the before pictures, oftentimes patients don't even realize that was them. And seeing that drastic change and seeing their look in their eye and that result that we're able to achieve for them, that is something that I didn't expect going into plastic surgery, how rewarding that is for me. So I would say that's my unexpected thing. Well, it looks like those are all the questions. If you have other questions, we'd love to answer them. Comment below or come see us in person. Thanks for watching. Adios.